to the cloud. Let me make co-host. All right, I just made Edwin a co-host. All right, here. Make co-host. Okay, you're done.
Okay, 1, 2, 3. Okay, so Edwin, can we start? Good evening, everyone. It is 6:40, and the meeting of Community Board 9 Health and Environment Committee has been called to order. And I know Edwin too, want to thank everyone for being with us this evening. It is a special day, sad one. Was September 11th, and I just want to acknowledge that and recognize it. I have someone, a friend, a neighbor who was killed at in ground zero at the World Trade Center. He was an attorney who worked in that building. And I'm sure that others have those they know or know through someone else as well. So, I mean, this is a case where we express sympathy, and our hearts go out to everyone in acknowledgement of September 11th. I also want to send out, sympathy, and I know a great deal of support is going to the country of Morocco with the major, major, major earthquake with over 2,000 people lost. It'll be interesting as how that fits in to what's going on with our climate and environmentally. We'll see if there's something at work there as well. So it's quite topical, but also very, very sad. Tonight we have most people, and Edwin, if you wanted to add something at that moment in terms of what I just stated, don't hesitate to interrupt me.
Okay.
At this moment, our meeting, most everyone will be on Zoom tonight. It is an in-person meeting as well. I'm not sure how many persons will be there. The word I got is that most people will be on Zoom. There may be one person who will come in to the office. As a matter of fact, it looks like one or a couple of people are there now, and we'll find out who they are. There is an I guess we call it some kind of edict or other, where in terms of public gatherings for governmental and quasi-government agencies, organizations, that our meetings are hybrid, but the members are to be in person. We should have 50 or 51% of members in person. That will not be the case this evening, but going forward, we should be. There is a big question mark, though, because of COVID and COVID surging in the city and in our area again, as to really how we navigate that, because there really are people who are, very reluctant, and I can understand that. But I know I knew this was going to come up. I have my I have the RSV vaccination and the flu shot. I'm going to get COVID as soon as I can get access to it. But I know it's still a big issue for others. That was not my issue tonight. Transportation was. I'm in Ohio, so transportation was my issue tonight. But the hospitals are really getting a high influx of COVID Edwin can speak to that more, but in two different circumstances, one from Edwin and one from our meeting with those at the Columbia University Irving Medical Center, they also cautioned us. They were just really alarmed themselves at how packed their hospitals have been. So I'm hoping we can get a better handle on that, and maybe via Charlene or Cheyenne from DOH this evening, we'll get a better sense of what's going on and some guidance and instruction on that. Let's see. Who's at the office?
Heather,
Hi, Heather. So we have a quorum.
I don't think we have a
Okay.
quorum because I'm the only one in person. I thought you had to be in person to have a quorum.
Well, we have a quorum in terms of members, but yeah, that's true.
I mean,
It's supposed to be, I just covered that though. So
no, I've been here. I've heard what you said.
yeah, it's just anyway, but we do have a quorum where we'll operate and then we'll see whether or not anything counts, but at least we'll have a record and we're recorded.
I say,
I
would add to what Laquita has said in regards to COVID, that if we can learn something from history and we travel back in time to December of 2020, the bells were ringing, but we didn't pay attention, I mean, to 2019 until March 2020. So in 2019, we saw the numbers were going up, not only here, but also globally. And then in March, we were hit with what we saw in 2020. So I'll, tell all of you, please take care of yourself, take care of those around you. COVID is not to play with. Get your vaccination if you are in the high-risk category. Right now, the government has pulled some of the fundings away. So the COVID vaccine is not going to be free in many places throughout the country. So until we're all safe, none of us are safe. Some of those who are not insured will have to pay for the vaccine. So this is a problem when it comes to public health and mitigating the spread of the virus. So we don't know what we don't know as we walk into this winter. If we go back in time, it was not pretty what happened during COVID. We were very reactive instead of being proactive. So when you are in large places, try to wear your mask. The best thing is to get your vaccine. And we'll see. Hopefully we never go back to that place, but it's not a question if, but when the next pandemic is going to hit us.
Yeah, I see the medical people are nodding their heads. So I know it's much more comfortable for people on Zoom. My plan is to be there. And if I can, as long as I can get maybe 4 others, we'll just try to keep that safe distance apart. The others can be on Zoom, but I'll do the best I can in terms of that. So again, thank you for participating even by Zoom, and for those who can, just remember going forward, we'll also just remind people where the office is, and we'll have both locations. We do have, we were requested to get masks and hand sanitizer for the office. So a number of boxes of face masks were picked up and brought to the office this morning. So we'll be prepared, and just so that you know. Let me say now too, I want to welcome our new committee members, but for the group that's here, I'll call the names. Be prepared, just unmute yourselves just to say hello. But our committee members, you've heard Dr. Edwin Torres. He's a co-chair of the Health Committee. He's already said hi.
Laquita, can we recognize our new chair, Victor, who is joining us live from the office? I just saw him walking in.
Okay. Okay. Hi, there's Victor Edwards, our new Committee Board 9 chair. who has walked into the office. So we heard
Thank
him
you.
laugh, and I see some hands clapping, applauded there. Thank you, Victor, for joining in with us. I'll continue with the names of the committee members. Elizabeth Eastman, I'm not sure if she's here, but Elizabeth is new to the board and a member of our health committee now. Amir, I need you to say your complete name, actually.
Hi, yes. Good evening. My name, my name's Amir Sadeghi is how you can say my last name.
Okay.
Really, yeah.
And welcome, Amir. And he is continuing a tradition that we have here at the Health Committee. Last year, Dr. Torres and his wife welcomed a new baby, a girl, this time. This year, Amir and his wife have welcomed a baby boy. So congratulations and welcome to our committee. So we don't know next year, the torch gets passed. Let's see. We also, I don't think Dr. Clotilde Manguia is on the phone. She's at a conference. She may be joining in with us a little bit later, but she's new to our committee. We have Patricia Ramos, who is absolutely wonderful and functions as our committee secretary, and that's hard to come by, and she does a beautiful job, as you will witness by tonight's minutes that were emailed to you. Patricia, are you there? She had to step away for a minute, but anyway, Patricia Ramos. And then we have Monique Hardin Cordero. Monique is excused this evening due to she and her mother have traveled to New Jersey to pay tribute to her mother's son on the anniversary of his death. And but Monique is also our second vice chair of the board. And I believe, and Heather Jason, our member who is at the office, she is also co-chair of Parks and Landmarks Committee. And Heather is at the office, and she represents us at different times at various committees as well. So welcome to all the board members, and a second welcome to those new members. Okay, so
Peter, if I may, Quita,
yes.
can you hear me? I'm
Yes.
running between two meetings, so I'll be back in a little bit. I'm at Arts and Culture next door. And I'm here. So the other thing to be noted, all our board members that are virtual, you must be on camera to be marked present for attendance. So if you are a board member, you have to turn on your camera so you can be marked present. All right?
Yes, Amir, you have to put your camera back on.
I'll be back. Thank you.
Thank you, Victor.
I'll be back.
And anyone else that I may have missed. Patricia stepped away. Patricia, okay, when she comes back, I will let her know. Okay, Elizabeth Eastman, there you are. I didn't think you were on, Liz. Yes, okay. So moving forward, can we have a motion to adopt the agenda unless there's something someone wants to add to the agenda? Members, board, committee members, can we get a motion to adopt the agenda?
I set a motion to start the agenda.
To adopt the agenda, yes.
Yeah.
Okay, can I get a second? Committee members, you should be off mute unless there's a lot of noise in back of you. That way we can get through this board quickly. Unmute yourselves.
I second the motion.
Okay, all those in favor?
Aye.
Aye.
Okay. Next, the minutes, minutes from the June meeting. That was our last meeting because we were away during the summer. Can I get a motion to, accept the minutes unless there's something to be added? Is there any addition
Is that a motion to accept the minute?
as presented? Okay, and of course, if there is something afterwards that you see, you can notify us. All those in favor?
Aye.
Aye.
Okay, and those committee members whose names I called, you need to be off mute. Okay, unmute yourself. I still see some muted, but work on unmuting yourselves until some noise is in the background or other, then we can certainly understand that. Okay, Patricia Ramos is back. Patricia, Victor was just here. You have to show face and unmute, unless there's a lot of noise in the background. Okay, to be present.
Hi, it's here. I'm here. I had to leave for a little bit, but
No, you don't have to. You said the text, but I just just letting you know about. You have
Yeah.
to be
yeah.
visible. Okay.
So, do you want me to talk a little bit about me or like?
No, we're okay. We're
Okay.
gonna move forward.
Okay, perfect.
He just announced that to be counted present, you have to show face. And we're trying to move it along, so if you're not muted, but we had that bit of voting. Apparently our meeting is counting this evening. So let me just move forward. I'll come back to the health forum. I want to just, since we lost a little bit of time as we were waiting, I'm going to come back to the health forum, and then there's a lot that the health committee has accomplished and done this year. And what we've done, Edwin and I, has been to invite those persons who are in key areas, key positions, who presented to us, had significant projects for the community, to give us just a brief review of their work, the highlight of their work, and to tell us how they project what they're going to be doing this coming year, the impact it might have, and what it means for our community. So just 2 minutes, and I'll just go down the list. I'm not sure.
May I say
I'm-
something?
Sure, Edwin.
I would say that in our community, people, we know that there's two big players, Columbia and Sinai, and they're doing a good job. But I would like to also remind everyone and recognize that we have other organizations that are smaller, that are trusted by the community because of their size. So it takes a big effort from everyone to make a healthier community. And we're very happy to have some of those partners here with us, so everybody can learn of the work that they do and how we can support them and have that bi-directional relationship so we can have a healthier community.
Absolutely. Thanks, Edwin. And some of those community partners have gotten grants if their service is in the health and human services area, and they are requested to come before the community board to talk about their project and what it means. And so you'll be hearing from a couple of them. But once you're with us, we need you to stick with us, keep us informed of what's going on as it concerns the health and environment of our communities through your projects. I don't know if Christine Marizzi is here or someone representing biobusiness.org. They had a bioscience junior scientist summer internship program, and I know it continues during the year. Is Christine here? Okay, I know she mentioned that she would be coming. So is there anybody else from that program? Okay, so we'll move forward. The Tau Omega Charitable Trust Fund, funded by West Harlem Development Corporation. and my friend and chair, Wendy Millette. I know Wendy is here, who's chair of the Tall Maker Charitable Trust. Wendy, can you tell us, 2 minutes, what you guys focused on and how you see the year ahead?
Yes, good evening. And thank you, Co-Chairman Laquita Henry, for reaching out and giving us the opportunity to talk about our West Harlem Development Corporation funded program. As she mentioned, my name is Wendy Malliott and I chair the Tall Maker Charitable Trust Fund. The main purpose of the organization is to encourage the growth of young people through mentoring and financial support of their educational endeavors with the award of scholarships. Recently, we've noticed that some of our scholarship recipients were unable to complete their college education, most likely because of pressures that are common mental health disorders, such as anxiety, depression, sleep deprivation, and stress. So in 2022, we applied and were successful to receive a grant from the West Harlem Development Corporation to implement our Making It Through program. The initiative is geared towards providing college students aged 17 to 25 years old with mental health tools and resources that will enable them to recognize whether they may be experiencing mental health challenges and to understand how they can get help and be empowered to do so, removing the stigma. Our audience is mainly residents of West Harlem. So for the past year, we disseminated information to our target audience through social media posts, videos, and workshops in the community. I'll put the link to our website in the chat where one may register for the program as well as follow us on our social media outlets. We'll continue this effort and we look forward to partnering with continue our partnerships with Community Board 9, especially the Health and Environment Subcommittee. So we're awaiting news that our West Harlem Development Grant is funded for an additional year or two. We do have some funds available. And we want to thank Community Board 9's Health and Environment Committee for your support of our program. Thank you very much.
Thank you, Wendy. And we already talked about you at another, your organization at our Friday Public Health Forum planning,
Right.
where we're very interested in your psychiatrist conducting a panel, not a panel, but a workshop room focused on helping teenagers that we're trying to attract. We'll talk about the forum later, but that's a yes, everyone was excited about that.
Good. And I've started, I'm sorry to interrupt, but I've started gathering our resources to participate.
Okay, great. As well as we have a promotional link, and I'm not sure if Anita Chang will be joining us this evening, but we also will be calling you in reference to assisting with the promotion on Link NYC, being featured in that link as well. Okay, now Ms. Charlene Gordon, who is public health educator at Department of Health and Mental Health, in the Office of Health and Mental Health. And they are key, and we liaison with them every month. It's a big department. We need a lot of resources, so they're here. So your 2 minutes, please. I know you have a lot, and you're a great resource person also to be at our public health forum. Charlene, your 2 minutes.
Okay, thank you so much. I just wanted to say thank you to you, Ms. Henry, and other community members for the invitation for tonight's meeting. So she's mentioned, my name is Charlene Gordon. I work for the New York City Department of Health. I am actually under the Environmental Health Division. And our focus, as far as the community, is educating the community about different environmental hazards in your home. Such topics we highlight is on lead poisoning prevention. We may do things, falls prevention for older adults. We do mold, we do pests. So our focus is more educating, connecting with different community partners in the neighborhood, and just asking them to see how we could best educate the community about these environmental hazards. We have staff that can present in, besides English, Spanish, Bengali, and Russian. And we, pretty much 9 to 5 job. And we do participate in some tabling events on the weekend, but that's all depends on, staff volunteering to do these events. And we're doing starting this month, the week of the 18th through the 20, I believe it's the 20th, the 22nd, excuse me, the 18th to the 22nd, we will be celebrating Falls Prevention Awareness Week, and highlighting some webinars and educational opportunity for our older adults, educating them on falls prevention. We will do things around medicine safety. So that's, one of the things that we are actually currently working on. We also, next month, will be celebrating National Lead Poisoning Prevention Week, which is going to be October 22nd through the 28th. And we're looking for a community partner in Manhattan to do something on the 24th of October. This year we're partnering with HBD. They have a outreach van, and they wanted to partner with us so that we also reach out to one of our partners and see if you're having an event on that particular day, so that we can educate the community about lead poisoning prevention. So that's something, if you're interested or you have a group or something planned that particular day during that week, you could definitely reach out to me, and I'll have my information in the chat. In addition to that, we have virtual webinars that we have on a monthly basis for the community. We're always looking for support in getting that information out to different community residents for them to join. When you do join those webinars, you do get a certificate for attending. And every month we have different topics. We partner with Poison Control and having, a list. Not a lot of time. Sometimes we do have a lot of webinars scheduled. And so that's what we also do. And lastly, we have educational materials. Some of our materials are in 14 different languages. And it's a great opportunity, for different organizations to order so that they can be able to distribute it out to the community and, educate everyone about different environmental hazards that may be going on in their home. So that's my 2 minutes for tonight. And I will be here, and I'll leave my information in the chat so that if you need to reach out to me, you can reach out to me.
Is there any way, Charlene, that you could give us some statistics on what's going on? We could set up, that can happen at another meeting, or send an email for distribution related to lead poisoning. There's still, how big of an issue is it still in the city? And what does it look like in terms of District 9 with buildings where there's still some eradication that is, that's not the word. There's another word that's used for getting rid of lead. What is the situation currently? I don't expect you to answer right now, but I think that would be good for us as soon as possible to have those numbers before it blows up in the newspapers. Maybe there's something we can have, actual data, and maybe what clinics are seeing in our area, what medical facilities are seeing in terms of children in particular, but anyone coming in with lead poisoning, asbestos, that kind of thing, statistics and data to see what the real picture of community health is. If there's anyone else that has a question or other, you can raise your hand.
I have a comment, Laquita. I had a question. Thank you, Charlene, for coming and giving us an update from DOH. For the seniors, it's very important to understand what falls means. just to give you an idea of what a fall can do to a senior. Those over the age of 65, when we look at epidemiological data, you have a 50% chance of dying if you have a fall and you have a hip fracture. This is when you look at the aggregate of complications. So please make sure that you attend this forum, get informed, get your other friends, because falls are very detrimental for our seniors. Charlene, this is a question for you in regards to lead. When tenants call for lead, this is DOH that comes out. How long does it take for DOH to come out?
Okay, so actually, just to backtrack a little, it is not, DOH only comes out when a child is actually tested for lead. We also have HBD. HBD is the one that actually comes out from multiple dwelling building. If the resident lives in NYCHA, NYCHA takes care of all their complaints. That includes lead. So we have 3 different agencies that responds to complaints and concern. Yes, DOH comes out with, when there's a child tested. They also come out when, if there's renovation being done in a building, and dust, debris, etc. is happening. That's how DOH comes out. But it is all 3 major agencies that actually responds to any type of that responds to complaints from tenants.
And what is the time?
So
I'm asking because I have the community and tenants who are complaining that when they call 311, they have a lag time of, I believe it's 40 days. And you can imagine that the landlord gets informed if there is, any disturbance of lead in the public areas, which is a problem. We're trying to, help the community deal with this lead situation, especially when it comes to abusive, landlords that historically have been in communities of color such as ours. So 40 days is quite of enough time. It's a lot of time. And by then, the damage is too little too late for an intervention.
I would make sure that I get that information as far as the various agencies. What is their turnaround time for complaint if someone lives in a multiple dwelling, as far as HBD. If a parent needs, as far as with us, it's more of the complaint as far as dust, debris, etc. So I'll find that information out and I'll definitely share that back with the committee.
Okay. And if you could, what about the October meeting? It would be great if you could plan a return then with that information.
Yeah. And I also wanted to say is, as the falls prevention, I will definitely put that information in the chat. It is a slew of different webinars that we're having. It's important. Yes, it's important for you and I to attend, but it's important to make sure that if you have any older adults, or if you're connected with any of the agencies during those days that we're having those sessions, to encourage them to sign up and then have their older adults join and listen to the presentation. And also too, we are available to present to them, coming to their centers and present to them on the topic. And it's not, at any cost. This is beyond the Falls Prevention Week. If they're interested, they can always reach out to us and schedule something for their centers or agency to have the members educated on falls prevention. So I just
okay. And Charlene, let me also mention that Walter Alexander chairs our seniors committee, very active. You'll meet him because you'll be involved with our public health forum, but I'd like you to deal with his seniors committee as well, and notifying them of any of the workshops that you have related to that. Okay.
Okay.
Thank you so much.
And
okay, stick with us. Now, then we move on to mental health is a general area overlapping all of our efforts. That was established last year. And we may need to continue that this year as an overlay. A couple of things, and maybe Edwin should speak on the first one. A big issue came up related to teens and mental health at Mount Sinai Hospital. And I'm not sure if Sandra Gale is still on, but the other effort we assisted in was with funding of the 340B funding with Governor Hochul. So when she comes back, hopefully she can tell us about that and the importance of it. So let's start with Mount Sinai Hospital. Edwin, can you give us just a very brief overview on our effort and the letter of support that we did and the reason for it?
We had one of our community board members who had an experience of her teen daughter who was placed on with the adult population when she was experiencing a mental health emergency. And it was brought up to our attention, the difficulty that they had with the system. And then when they went to the ER, you know, one would never think of having a pediatric who has a broken bone going into the adult, or even just showing up for asthma. You take them to the pediatric side, you don't take them to the adult side. So we reach out to Mount Sinai with a strong letter in regards to her experience, and wanted to make sure that this doesn't happen to somebody else. We have to think about what happened here, and also to the individual that this happened to. Not because she's a community board member, but we're thinking more of those who do not have this platform so they can voice their concern. So our concern was to how many other has this occurred, because we don't have the information. And we want to make sure that our kids, they are taken care of properly, and we don't traumatize them a second time when they are seeking help. Because as we know, post-COVID, our youth has been dealing with a surge of stress because of the pandemic. We're all dealing with it. But if you look at what's happening nationally, teens are having a rough time. And I think our healthcare system, they also have a duty to make sure that they have a proper place that doesn't traumatize them again. So we have been talking back and forth with Sinai. We think that the conversation is not done. They have some promises in regards to meetings with us that we're still waiting for, and we will be following up on this. But that speaks to the need that we have in the community of having places where not only the adult population, but also the teens, because if you can imagine, if the parents might be dealing with, you know, stressful situation, perhaps the kids might be dealing with the same. So we need to have access in the community for mental health across the lifespan.
Exactly. And we have contemplated the president of Mount Sinai, at least their west, I believe it's called the West Side, Mount Sinai West, coming to speak to us. They were, he and his staff were very involved, coming to all of our meetings when they were looking to expand and explaining that to the community. So our next step is, if we don't hear from this one department, is that we are contemplating going directly to the president of Mount Sinai, so that we can get the response for our community that we need. So we've been an action committee, very much action. Thank you so much, Edwin, for that. And let's see, is Sandra Gale?
I'm still here, Laquita. Thank you
Can
all.
yes, can you just, everybody was given like just 2 minutes. I know you worked, you know, the Dickens out of the 340B to
We're
help
still doing
bring. Okay,
Yes,
can you tell us what you're dealing with and what you foresee and what you might anticipate asking for in terms of support?
Yes. And so before I begin, though, so that I don't lose trains of thought, I'm actually mobile and working off of a cell phone, so forgive me. The mental health that was discussed earlier today, please, everybody, I don't know if people are aware, but Heritage has launched the Center for Behavioral and Mental Health. We now have 13 full-time social workers, 2 psychiatrists, 2 psych nurse practitioners. We went from 3 months to 2 months to 1 month, 4 weeks, 3 weeks, 2 weeks, 1 week. Now we're able to schedule within 24 hours appointments to address the mental health needs of our community. We are a health center, but we also have a center for behavioral and mental health. And so if anybody needs anything, please include us on these meetings going forward. But we are doing a marketing and an outreach so that people are aware of what we're doing. Even if other organizations have the ability to see patients, they may not have the ability to see them as quickly as we do. And I just wanted to get that out there, as we have been working very diligently to be able to achieve that. On the 340B matter, for those who are new on this phone, Heritage Health and Housing was the leader behind the litigation against the state of New York for wrongfully taking the 340B discounted drug money away with respect to the Medicaid reimbursements. We now have 75 organizations supporting us, and we have been very stern in what we've been doing. We and our efforts have achieved half of the payment that was taken from us. We did not drop our lawsuit, as statutorily we still have not received the other half of what is owed. We are continuing in our lawsuit. I will continue to keep you updated. If we need anything, I will reach out to both you and Edwin. You guys have been terrific. We ask, please, Danielle Milano, our Chief of Medical Affairs, is also on the phone this evening. I've asked Edwin and also you, Laquita, in a text tonight after the meeting began, to please include us so that we could participate and be good, active members in our community, so that we could all help each other to achieve what we need to do so that our community has increased access to health care. Please, everybody, rest assured, I am not a relaxed attorney. I am making certain that we're doing everything we diligently can to make certain that we fix the wrong that was done by the Department of Health for the state of New York against our community. It actually applies all across the state of New York, and we're going to do the right thing. And I believe at the end of the day that we will prevail. However, we are not there yet, but we will keep you updated. Thank you, Laquita and Edwin.
Thank you so much. Sandra Gale is CEO of Heritage Health and Housing. And she's busy, and they're doing terrific work there. Dr. Milano, who's on this call with us, is the medical director at the Heritage Health Center. While we have, let's just see, is there any question about what was just discussed relating to mental health, our interaction with Mount Sinai, as well as our interaction with Heritage as it relates to their mental health program? Any questions?
I would say, Laquita, if we can get a flyer so we can distribute it around the community. I know that as a provider, sometimes that information doesn't get to the clinics. And a lot of these providers are looking for places so they can refer these patients and they can be treated. And
yes,
turnaround time here is unbelievable, because to trying to get an appointment for anything related to mental health, you have to wait at least 3 months at a minimum. So
Well, this is why, Edwin, it's taken us almost 3 years to achieve what I just announced.
yeah.
And most of our appointments on our internal audit have been able to be achieved between 24 and 48 hours. Our goal is within 24. We had a meeting with another group and we said to them, listen, even though you have psychiatry, please, you may be overwhelmed. Let us do a little bit of lifting and work together as a community. We very much welcome participation in the meeting with Mount Sinai. We have the right people in our group to attend, and we very much look forward to crafting with you whatever you need with respect to our services. And this is why we are a community. So if you have some guidance on how to get the word out of what we are doing and who we are, we very much appreciate it. I also would like everybody to know that we are hiring, and we are hiring medical staff as well as behavioral and mental health staff. We're growing and we would like to continue to grow. For those of you who are new on the call, we are building a new state-of-the-art health center 3 blocks south of where we are on Amsterdam Avenue, just 3 blocks south of 145th Street. So it will be good to service our community and to be able to continue to grow. If anybody needs anything, Edwin and Laquita have our numbers. Please reach out to us. We very much appreciate it.
And do you have flyers already of announcing the Center for Behavioral and Mental Health, or any of your services, but particularly the one you just announced? Or
we have it on our webpage. We have it on our webpage, and there is a brochure that as we've been meeting groups, we've been presenting it, but they've been tailored almost like an RFP to the particular group. But I will sit tomorrow with our marketing group and craft something for you so that we can get it out, because we'd like to do a blast to everyone, including, I said to people, seniors who feel alone, whoever needs any kind of behavioral and mental health, whether it's they've just lost a son, or they're grieving, or they've got a prognosis and they don't know how to handle everyday stress in life. We're here. We've got social workers, psychiatrists, nurse practitioners in psych. We've got a whole team that we're building, and we're committed to continuing to build it.
And so we'll also have Anita Chang. We're developing the Link NYC, which there are 84 what are they, not panels around the district. And so Anita's been looking at, she's come to our public health forum. She's helping in the planning of that. And we could easily come to, I mentioned to Wendy, and so I'm mentioning to you as well, Sandra, that opportunity to provide something related to those kinds of stresses, so that people are aware not only of our health forum, but where they can go for other services. And that's with all of our community partners.
This is a good platform to share, Sandra, because the seniors is also another group that can deal with depression. Today I had a patient, he was married for 47 years and he lost his wife 2 months ago. Can you imagine, he lived with his wife more than his parents technically, right? Because at 18 you move on, you go to college, and you live out of your house. So these are real stressors that we go through in life. So send us whatever documents you have. We'll have the office share that with the community, because I'm sure that all of us probably know somebody that can spread the message, and somebody might benefit from having access to a mental health care that is so quickly.
And I may ask of you, Edwin, if I can introduce you to one of our new psych nurse practitioners who originally hails from Ghana, and he's joined our group, and he's got tremendous energy. And I may text you and ask for a time that we could just say hello, to put some things together to benefit everyone in our community.
Absolutely. Absolutely. Thank you so much again. And I'll just keep moving unless someone raises their hand. Okay. Thank you so much, all of you. Now, let's see, we're moving on to a big area for us is maternal awareness for pregnancy health. It's a major issue, particularly as it concerns women of color, particularly Black women, and maternal mortality. That is still a major issue, where there are more women dying at childbirth or shortly after childbirth. And so the person, I had reached out to a couple of people who had presented to us before. They're not here tonight, but we will call on them, and they could come back at next session. But that, I want you guys to know that that's a major concern of ours. And doulas have been acknowledged as being very critical to the life of the mother, in particular. And we want to keep that in front of people, knowing that there's a resource here. It will be one of the workshop areas at our public health forum. And so I regret that they telephoned, but I regret that they're not available this evening to talk with you, but talk with us, but hopefully October. Now, there's a lot of material, and in this absence, I see Deborah Levine is here. Deborah, not necessarily for maternal health, but we've asked for 2 minutes. You are doing so much at your institution. And can you just, no more than 2 minutes, tell us what the pressing thing is? We'll have you come back for anything else you want to expand on. But tell us what you're working on now from the health area, health and environment, and where you see it going and how we may be of assistance.
Good evening, everyone, and thank you very, very much. And to our partners at Heritage Health, congratulations. Long time coming. Super excited to help get the word out. My name is Deborah Levine. I'm the director of the Harlem Health Initiative for the City University, your graduate school of public health and health policy. Have had the opportunity to talk to you about Harlem Strong, which is our mental health initiative, training community health workers around anxiety and depression and working with our providers in the community, Heritage being one of them, so that we're cross-training our community health workers who may be doing work in diabetes and hypertension to identify anxiety and depression. The motto is that we are not going to tell people when they say they are tired or they don't just feel like they have the energy. We want to support them in being able to connect in ways that help. So happy to come back, share more details around Harlem Strong. The other area that we are currently sitting in, and I heard Community Board 9 loud and clear, was to create a survey looking at knowledge, attitudes, and beliefs across Community Boards 9, 10, and 11 around cannabis. And so we have finally gotten IRB approval. We have it in English and in Spanish. Unfortunately, I couldn't find the funding to do French, but hopefully, as I cross my fingers and ask for some additional volunteers, we may be able to get that to happen. So the survey launched September 7th. It will close October 7th, and the goal is really to hear from the community about what they want, what they know, so that we can help design curriculum that is for not only our community members, but also our community-based organizations so that they can train their staff so that this conversation can be integrated into their work, but also give our community boards an opportunity to have this data so that they can help make informed decisions about next steps. Thank you.
You know, thank you, Deborah. I saw it and I got so swamped. It's not too late for that September. Okay, so it was emailed on September 7th.
I put it out September 7th. We have it in Spanish and in English. And I'll be happy to drop it into the chat, and I'll also resend it out to you all to participate. It takes 7 to 10 minutes max. It's not a long survey, but we cannot in good conscience help write curriculum for education until we sort of have some baseline about what the issues and concerns from our community members. So I'll be happy to drop that in the chat.
Yeah, in the chat. And everyone, please pull it up and respond. We depend on that. And I will forward it to, I have 61 organizations attached to the emails I send out about our meetings. So I'll send that out also. But if you know someone, others inside your organization, those represented or in the community, please see to it that they get it. Because we have been trying to be very strong, not only with surveys, encouraging surveys, but with clinical trials also. Hopefully in October, we'll resume our clinical trials that get reported, the research that's going on, because Edwin, I always knew it, but it's something that Edwin talked about so well. If we're not in the mix and we need to also participate, then how can we say that why isn't some research done on our community with certain diseases, certain illnesses, certain impacts on our lives unless we participate? And so we have to encourage it. We want to encourage trustworthy purveyors of information, those coming after the research. And there we think we've identified some groups. So we're not saying just let, fall for any research, but we do need to participate. Surveys and clinical trials as well. A little bit different, but still they're providing information to us. Thank you, Deborah. And like I said, I know you have a lot going on, so feel free to reach out if there's something in particular you want to expand on. When will you be ready for the Harlem Strong report?
We could come back to you in October, not a problem. I'll be happy to draw up a one-pager to give you an update. Happy to do it.
Okay. But just a couple of sentences on what that is again, the Harlem Strong.
So the Harlem Strong is a community coalition that we are building across community boards 9, 10, and 11, working with Health First, working with community providers, community-based organizations to train community health workers to identify anxiety and depression, and then help make those referrals.
Okay. All right. Thanks again. Any other questions or statements? Okay, so that's a couple. Thank you again. And I just briefly mentioned clinical trials. We've had a great relationship with Columbia University Irving Medical Center. They have made 4 presentations on the latest research available. And generally they require a little bit more time for their presentations and the latest research that they've come up with. So they will be at our October meeting. Combating noise pollution. A lot of times people don't think of that from the standpoint of health, but it is. Edwin, we have, while he's getting on, we even, our committee came up with a resolution on noise, as well as a letter related to another small business. So Edwin he spearheaded that and give us some couple of minutes feedback on that, because I think we had some success.
Noise, unwanted noise. It has been shown that it increases cortisol level in folks. And when we go back to a study called the Framingham study, which looked at blood pressure, it has been tied to issues such as cardiovascular events, strokes, heart attacks, and death. And many cities, they take noise very serious. So does New York City. However, in communities of color like ours, sometimes, noise can be an issue for many of our residents. We had an issue with some residents of 517 West 139, if I remember correctly. We were able to help them. It takes time to get all the city agencies involved. But please know that if you are dealing with noise issue, we would like to hear about that, because it is a pollutant and also a health hazard. Noise has been used to torture people. So imagine you living on a second floor, as we have one of the residents in that building. She had a husband who was going through hemodialysis. And then you can't sleep because of the noise until 4 or 5 o'clock in the morning. That is very stressful. So here at the community board, we have taken some steps to make sure that our community can also, decrease that pollutant, and we can all enjoy, our space. And also it takes education to some of the businesses that might be doing it. So some of them that we have talked to, that have been very receptive. We have very, very, very few players who have not been good partners, but the numbers are very small. And I would like to remind everyone, when you look at the 311 data, the #1 complaint in Community Board 9 is noise. And when you look at the city overall, noise is also #1.
It is it can be a health issue, but we have had some recent successes, Edwin mentioned. And Edwin, you may want to stay, let's see, the auto body shop. I'm not sure if, is there an update on that? Edwin, on the auto body shop, or did you cover that with?
To
the
my
auto-
understanding, we haven't heard anything in regards to the body shop. The last time that we were there, we had a commission from the community board with the Department of Transportation, the Department of Environmental Protection. And the task was for the residents to continue to call 311 to document the pollutant. Because when we were there, yes, we noticed a smell, but you have to have certain machinery to capture it and measure it. The residents, they haven't come back to us in regards to that issue, but that was something that not only did we follow up with the city, but we had the chair, the co-chair, a couple of the co-chairs from the different committees be out in the field trying to address that issue. And we're thankful that we haven't heard back from the community members, meaning that probably they're not dealing with this issue because we offer, our help if they needed it.
And the same might be so with enforcing violations to combat air pollution and improve community health as it concerns in the internal issue with one of the buildings. One of our board members, and not only the board member, but others in her building came to complain about a nauseous building fumes at 3609 Broadway. And we were helpful to them and helping to get HPD, not HPD, the Department of Environmental Protection there. And with some help, they uncovered a heating situation that was causing that, and to work out something with the owners of the building next door to them. And so after a series of these calls and documenting by a number of persons in the same building, they were able to work out something related to that. Hopefully now that winter's coming, it's not going to be a problem again, but it seems to have been resolved according to our community board meeting. So we're very pleased about that. And I believe that that's it in terms of that particular story.
And I would add to that story, Laquita, they were dealing with that for, I believe, 10 years, 10 plus year. They hire a private company to try to measure the fumes that they were getting. Thankfully, this past year, we were able to resolve that issue.
Yeah. And that we're very pleased about that because people were getting sick. The next, Edwin, again, this, I commend you for your battling this issue, but we as a committee need to do a whole lot more, and as a board, maybe involve a couple of other committees, but the whole issue of commercial trucks and idling and taking up parking in our community creates an air pollution issue as well. And we came up with a resolution for that. It did go to the city, and actually the mayor's office has set up some task force because this is an issue across the city. We need to follow up in terms of what has happened with that task force. But Edwin, while you have the mic also on the commercial trucks, and
I'll speak to that. I see that Amir has his hand up. So we can hear from him and then I'll speak.
Yes, thank you, Dr. Torres. I just, Laquita, before we got too far away from the noise pollution item on the agenda, I thought maybe to take a moment to raise some awareness or hear some perspectives about siren noise up in our district, which I actually find to be the most significant contributor to noise pollution, much more so, I think much more significant and also with associated negative health outcomes for compared to noise pollution from bars or restaurants. And this, I think, also does intersect maybe with the next agenda item about idling trucks, the commercial trucks, which themselves make a lot of noise. But back in July, I actually had Youtha circulate a survey from Councilmember Rivera, so not in our district, but she is a council member downtown, who introduced legislation in the city council to address siren noise. And you know, much like my colleagues on this committee, I do very much celebrate and commend you know, health stakeholders like those at Mount Sinai. But I just, as a resident here in Morningside Heights, I have noticed that the Mount Sinai ambulances are just so much louder and louder when there's not really seeming to be any traffic obstruction in their way. So I just wanted to raise that, just as, you know, Laquita, as you mentioned, I'm a father of a newborn, you know, and ambulances are and sirens are very loud, and I just don't know if others on the committee feel that way, or you know, if we could maybe lift up Councilmember Rivera's bill to address siren noise, which I think would help.
Absolutely. And I mistakenly omitted the Serenity Committee in this presentation, but they can, we can get them to come again to the October meeting. But they met with us several times over the last 5 years, more than several times. It was a major issue for them as well. And we were able to bring together the respective parties at Mount Sinai, as well as the area dealing with ambulances. And also there's an area with the city of, and Edwin or anyone else, you can correct me. There's also an agency with the city that deals with this and helps to regulate the sound, the pitch, all of that. And so we thought it had gotten resolved, but to some extent there had been a change, but with all of the regulations, it's not resolved enough. So we need to invite them back, but they seem to have been stymied because of what the city put out in terms of how they, not so much the city, the hospital. I believe there's something federally regulated, and they were advised to go to federal government. Of course, this means a lot of bureaucracy, but that's where I recall it being left. But I'll reach out to the Serenity Committee representatives to see where there are. Edwin, anything else you recall from it? But I know it's a federal issue.
I would add that the community board, I believe we wrote not one, but 2 resolution in regards to this. And the data for noise, the city, they have is whether it's residential or commercial. So when we speak about noise complaints, these are what gets logged. There's no complaints such as ambulances that you can, or emergency vehicle that you can record. However, you know, these unwanted noises, they do create a problem. It's good to document them. And I would recommend, Amir, perhaps, you know, suggesting, and we can bring something forward where in the 311, they can record, you know, other type of noises, because right now, when you do a complaint, is either residential or commercial. And the noise complaint that we have in the community mostly is coming for noise, not, you know, the ambulances. Not to say that we haven't addressed that, because we did deal with the issue in Sinai. We had several meetings with Sinai, and they tried to accommodate that. Maybe things are getting a little lax again, and we can bring them again. But there's a group called the Serenity Group who have been working on this for years. But the community board has been very active in this and passing resolution trying to help mitigate this pollution.
And I will reach out to the Serenity Committee again. I think they had the email, but we'll see to it that they're at our October meeting, because they have done an extensive amount of work and documentation on the impact of health, that sound is to health. Any other questions to date? I mean, not to date, up to this point. And I apologize, when we were talking, I didn't, my picture was facing something else. So now I am, since all committee members are to be showing themselves, I now can be seen. Okay, moving right along. Update on 5G. We did a resolution after hearing Odette Wilkins and a group that she brought with her talk about 5G and its negative impact on health. Odette is with us this evening. They have been so busy, and I want to publicly thank Heather, Jason, who while I was on a meeting with them, also appeared on a meeting, in a meeting, and has been diligent about participating where she can. And so if there's, Heather, if there's something in hearing Odette that you want to add related to 5G, please feel free to do so. I know that they had a series of gatherings around Manhattan, including in Harlem, and I was away and wasn't able to be at that particular session, but there's still a lot of work ahead. And so, Odette, please tell us where you are now. And I know you have a couple of minutes, but you can always come back when there's something else more intense, but bring us up to date as quickly as you can.
Yeah, fantastic. It was great being part of the tech conference. And but it wasn't, we really didn't talk about 5G. We really talked about cybersecurity and how it's affecting senior citizens. And there was an assistant district attorney there who actually heads up cybersecurity crime in Manhattan. So he was really fantastic. I didn't really have a lot to contribute because it was more or less having to do with the day-to-day cybersecurity things. But I do have a number of things to report. We've started a series of town hall meetings. And our town hall started with Section 106 review, which is a National Historic Preservation Review, which is now required by the FCC, along with National Environmental Policy Act review that is required also by the FCC of all the Link 5G towers. And then we had the second town hall was featuring Chattanooga, Tennessee, which has been a fiber success story. Fiber optic success story, since everyone is connected to fiber, businesses, schools, homes, and they also have free programs and free internet access for households that have a child that's in school. So that was a fantastic program. And we also have the president of the Fiber Broadband Association. Then the next one, it has to do with the federal bills that are now being fast-tracked through Congress, which will take away and eliminate environmental review. And that's going to eliminate essentially historic preservation review, and expressly prohibits moratoria. That's exactly what has been our success in New York City. We now have 16 community boards that have either voted for disapproval or called for moratoria. That represents an average of about 2 million New Yorkers. That is more than a quarter of the population. If these bills become law, we can kiss the environmental protection goodbye. So we have to really activate the New York delegation in Congress. And I mean all our representatives in Congress. And we are holding weekly meetings. I'm holding the weekly meetings. I'm calling them now Preserving New York in New York City. And we're going to be discussing how to handle the federal bills. And we're also handling the federal bills on a national level because I also co-chair the national call for safe technology. We just had another town hall last week and we featured Gigi Sohn. Gigi Sohn is President Biden's former nominee for the FCC. Her nomination was scuttled by the telecom industry. And she would have been fantastic because she really is a consumer advocate. Now she's also working with Utopia Fiber, and that is a consortium of about 11 Utah cities that have banded together in order to provide fiber to the premises. Our next town hall is going to be on cybersecurity, because right now there's one of the other telecom bills that are being fast-tracked in Congress is to do a cybersecurity analysis of mobile networks. But the problem is that it expressly excludes 5G. 5G, the industry knows, is the least secure and the most hackable of all mobile networks. So for it to be expressly excluded from a federal bill, which has now already passed the House and is now in the Senate, it being considered, is ridiculous. So we're also we want to make sure that that gets amended. But the big thing right now is HR 3557, which is the American Broadband Deployment Act, and HR 4141, which is the Broadband for Americans Through Responsible Streaming Act. Those are the ones that are the most dangerous, and those are the ones that virtually eliminate all NEPA review, National Environmental Policy Act review. So that means we can, kiss the environmental review goodbye. So we have a problem now, and there are now over 90 telecom bills that are going through Congress, and there are about 6 or 7 now that are being super fast tracked, and that includes these 2 bills. And 3557 is the worst of the worst. It will take away all local permitting. We can just pack up, and my whole group can just pack up, and we just won't be able to do anything.
Do you have a read on where our legislators are with that now? The congressional team from New York?
Well, the only congressional team from New York, well, I've been trying to get through to Nadler's group. They have not responded to me. I've been trying to get through to my personal representative, Grace Meng. They have not responded. People are not responsive. And so, so who is your federal representative for Morningside Heights?
Well, it would be Congressman Espaillat, as well as Nadler is closely now. I know his district got changed, but he's, there's still kind of a relationship there, but Espaillat. And seems like, Espaillat would be it.
So we need to
maybe there's an awareness, or maybe they're so involved with all of this, so much other stuff. That's how these bills can get fast tracked, because our congressional people are so busy with some other, and there's all these important issues happening at the same time. I'm wondering, are you having some meeting? Because everything you said is important, but it needs to be broken down and understood. I'm just wondering, in a small group where this can happen, when is your next meeting?
Okay, well, I have a meeting every week for New York City, and I'm discussing it there. And I also have another special group which is dedicated to the federal bills. So on Wednesday is when we have our New York City meeting. Thursday is when we have our federal bills meeting, where we are dedicated to the federal bills and the strategies that we need to defeat them.
We need to learn more about all of that. So I'm wondering, is there one of our or 2 of our committee members who can, on the environmental side, sit in so we can begin to assess and weigh what this means for our community? I know Heather has when she could. I'm not sure if you still would be interested in sitting in, Heather, to assess. I will try to definitely sit in now that.
Sit in when I can, but things are just getting really busy right now.
Okay,
Yeah,
I can sit on Wednesday.
That's Clotilde. Okay,
Yes.
Dr. Matt, that would be, what's the time?
On Wednesday,
Oh,
it's from 2 to 3:30. And on Thursday, that's the national groups that are meeting on the federal bills. That is from 4 to 5:30. So I can send you, well, you already are on the permanent invitation list for the New York City group. If you also want to get the inside scoop on a lot of the stuff relating to the federal bills, I can also put you on that list so that if you have time, you can come in.
Okay, so Clotilde, can you put your email, your full name and email address in the chat for Odette?
I'm
and then
already on site, so I'm not connected through internet, but I'm gonna send it to you on your message, my email and my name. Yes, I'm in a room.
She came in.
I'm in a room now. I'm no longer I'm not online anymore. I'm on.
Yes, I see you. I do see you. Okay. Okay, so right now, if I heard Heather correct, whenever she is getting busy, but when she can sit in, Clotilde, with her medical background, that's very important. I don't know, Amir, would you be available to try to sit in as well with that? Could that be something for a couple of sessions?
I think, you know, with my day job, it conflicts a little bit with the times of those meetings, but I
If
do
you looked
apologize.
at the material, maybe, if you can't sit in the meeting.
Sure,
Okay.
yeah.
And I will too. I think this is super important because otherwise it's going to hit us and we'll say, wait a minute, when did that happen? Why didn't I know about it?
Exactly.
So this, it's important. So Odette, you know, just get the information, whatever it is, some of the points that you just made. If you have reading material that we can read and glance over, send it as a packet and I'll get it to Clotilde, Amir, Edwin, and myself. I'm not sure who else might be, and Heather, of course, and just see what we can do.
Okay, fantastic. Absolutely. Thank you so much for having me.
Thank you, and you're doing terrific work. It's a lot of work, but it's important work. It's critical work, and unfortunately now we're pressed for time. When do you think? Obviously, I guess when will they start voting? I know you mentioned fast track. When will this voting in Congress?
Well,
when is it anticipated?
3557 and 4141 are, I've been told by one of the staffers that they are both going to be put into a must-pass bill. They're not going to be separate bills. They're going to be putting it into like a reappropriation bill or a reauthorization bill. So it's a must-pass bill. So it's probably going to pass the House. And it's in this, and so we should let Espelette know, and I'm sorry, I'm mispronouncing his name. But Espaillat know, along with all of our other delegation, in order to oppose it so that they can also call up, you know, Gillibrand and Schumer and say, hey, we couldn't stop it in the House, you have to stop it in the Senate. Because these can't go through. Now, the good news is that it passed on a partisan basis. So the Dems did not vote for those two. The Republicans did vote for them. In the Senate, we do have a very slim, we do have a majority of Democrats, but it's very slim. And the probability is that Biden will not sign them. But we can't assume anything because the stakes are way too high and it will eliminate local permitting opportunities. It will eliminate, it'll have total federal preemption in favor of the wireless industry.
All right. So we'll Wednesday and Thursday this week. Okay, so if you get the information to me tonight or in the morning, then I can, whatever packet, put everything in one email, then I'll email to our full committee and then see, you know, hope that the ones named tonight.
Yes.
Okay, I can do that tomorrow. I can do that for tomorrow.
Okay, great.
Thank you.
Cybersecurity and AI.
Let's see. So, Clotilde, you were saying something?
Yeah.
No,
yes.
just
I just say that I'm just coming from a whole AI and cybersecurity on healthcare the whole day. So it's so coincidental.
Yes, it's very serious, and we.
Yeah, it's very, yeah.
There. Thank you, Odette. Moving along, Grant Carlton Davis at Grant Houses, well, he's also on our board of directors, and he, a general board, I should call it. He had at one point a complaint with water in Grant Houses, which has since been resolved. And I think it would be interesting to hear from him because he represents how one person can handle a situation. Oftentimes we feel that, oh, what can I do? We need a whole group. But there's a way, a process that he went through, and the situation did get resolved. The building management, through his complaints, worked with him. And I think there's something that we can learn from that. And so his water situation has been resolved. And of course, that was a process that he had to go to, and he was through, and he was pretty diligent about it. So that's pretty much our review of, there's much more, of course, but we'll try to do more in October and see what we need to act on to help our communities. There's a lot of information we need. Oftentimes we're going to have to hear from, both sides of the story. We can't, as a community board, just hear one side, and it's important. So we're going to need the committee, the entire committee, helping with taking on getting information on particular issues and helping to provide the feedback that we need so that we can make a decision on what our community needs to know, what we need to sound the alarm on. Fortunately, we have a couple of writers here from the Columbia Spectator. They are a very respectable source of information, and believe it or not, can get the story out into broader circles. So if any of you want to reach out to them, they have the chat information, of course, and if they can be helpful in getting the information out, it'll be important to utilize that news service. And thank you for being here, Columbia Spectator. As it concerns 1727 Amsterdam and displacement of health facilities, I do not have an update other than the general board of the community board passed a very strong, well-documented, very reads like a novel resolution, primarily added to and put together by then board chair Barry Weinberg. Very well done. We need to make it available to everyone on the committee and our broader audience if you're not. So I will send that out so that you can see where the board stands on 1727 Amsterdam and displacement of health facilities. We're trying to make them take another look at what we see that what would become, let's see, it's at 145th and Amsterdam Avenue when we say 1727 Amsterdam. What we see as a prime location, a beautiful beacon on the hill is what I like to say, and apparently that's being used. And we want to be heard by those that are undertaking this major change, which we were not made privy to. When I say we, the board and the broader community, actually, until they were far along with their plans, they being Health and Hospitals Corporation and BRC, Bowery Resources Committee, I believe is what that stands for. So we are at odds, but I'm not clear on what the update is. One of the issues, though, is that these health facilities will be required to relocate. And that creates a financial situation as well as for the community, a situation for patients. And we've been trying to ameliorate that. I believe that Heritage, which has this medical center in that building, is in a far better situation. But Dr. Milano, are you prepared to make any remarks on where that is now, or even give background to where I did not give background? Edwin as well.
Yeah, so Sandra Gale is still on, and so she may have more to add. But yes, the as far as I know, we are in a holding pattern at this moment, and it would be very disruptive to us and to the community. You know, remember that this is where a lot of people came to get their COVID vaccines and continue to come for testing when they don't feel well. And so there's a battle going on, and everything's in a holding pattern at this moment.
Thank you, Dr. Milan. I'm not, Edwin, Sandra Gale. I'm not sure if she's.
Hear me? Yes.
Oh, great.
Did you want
Sandra.
to add anything? I was trying not to be too long-winded with it, but I may have left out something key, very important, that needs to be referenced in the whole 1727 Amsterdam, where we are now, where things stand now.
Well, we're obviously not concluded on any resolution with respect to the matter, and we will fight vociferously with respect to the removal of the healthcare providers from the current building. Obviously, there are many providers. It's not just Heritage that are located in the building. We've got Dr. Jackson there for optical as well. And we're working together as a community to make certain that the developers don't get away with displacing very valuable healthcare in our area. We don't need another further saturation of the type of housing that they're looking to put into our community. In fact, quite the contrary. It is our view that what they need to be focusing in on is making certain that we have increased access to healthcare, not a decreased access to healthcare when the numbers are moving in the direction that dictate that healthcare needs to stay in our community. Other than that, I mean, I sound like a broken record all the time with this, but we will be working. Our chairman, Ms. Adrienne Thomas, has been doing a yeoman's job at handling and helping to steer what's going on. And Laquita and Edwin, we've been working very closely with you as well to keep you apprised, and will continue to do so as further developments enter the foray in terms of the action concerning the building that we currently are in.
I know one of the things is that I know we are supporting the health facilities, and Chair Adrienne Thomas has asked groups for a letter of support, and she's had meetings with representatives of the city council in reference to a forced move and trying to force out the agencies before year end, or just at a time where it would be just too difficult for them to do it as smoothly and without just disruption. So we were part of that meeting. The chair, our board chair and vice chair at that time, who's now our chair, and others were very active at that meeting and have promised a letter of support when needed. And so she indicated that right now it's not there, but that your lawyers have indicated that once that happens, if it's needed, you will reach out for a letter of support.
Yes.
Not be forced.
Yes.
I'm not sure if Edwin had. Oh, I'm sorry, Sandra.
And we'll continue to keep you apprised of this.
And
It's a go on, Edwin.
And I would recommend for everyone, even if you are not directly impacted, here we have an opportunity to create a site that the entire community can be proud of. Think of 145th and where that sits in Amsterdam. They have a chance now of creating housing, but also at the same time, not just watching the needs of the community and taking from Peter to give to Paul. And we have had several meetings with them in which we are looking at resolutions. The best projects that can take place are those in which you have the community engaged, not where you come with your project and you impose your views as to what we need because that's what you feel that we need. We asked them if they did a community health assessment so they can understand the need. Such was done from their needs, not from the community board 9 needs. And this is where you have problems because the community, you know, we will benefit from housing, but at the same time, we don't want to lose the services that are there and the space for the services that are provided there. So this is to be continued. We want everyone to be engaged because if we do that, then we're all going to win. And when we see a beautiful building that serves the community, we can say that we all push it forward.
Yeah, this is a major issue in the community. And so we're fighting it. We were made aware that CBS News did a story on the Emma Bowen Health Community Health Center that's there. And where we are partners with Emma Bowen as well, we know that this has to be somewhat disruptive for them, just as it is for the other services. But CBS came out and did a story, and their chair put the best picture on it. But we know that as long as we can, and hopefully we'll be successful, we need to fight what they're trying to push on us. That would not be a welcome appearance and situation at all. We did a letter. Our health committee assisted with a letter that was signed by Victor Edwards that went to CBS News indicating that there's another side of the story that they did not hear. Everything was not hokey dokey, is what we told them. And that there are many in the community, many residents, many associations, and stakeholders who are not pleased with what is going on and how disruptive it is and how the community was not taken into consideration, nor a study confirming that what they wanted to do was what was needed. CBS News has responded to us asking who else should be should be spoken to, who else should they give some attention to. Our chair, I believe, has responded. We talked, I believe some groups have been mentioned and some individuals have been mentioned that they should talk to. I'll follow up with him on that tomorrow, just to make sure where we are, because I know there still may be information he wants from our committee so that he can feel that it's, you know, fully, the opinions and thoughts are fully represented. So again, we're an action committee, letters of support, resolutions, you know, reaching out to news outlets, we're doing it, but we, you know, we need all the help we can from our committee members so that we can help our community and protect our institutions.
I wanted to go back, Laquita, real quickly to the resolution that we passed on trucks.
Okay.
We didn't talk about that. Quickly, everyone. The city has a law that you cannot park any commercial vehicle overnight in residential areas. This is very important to us because, you know, these trucks, they're not stored in our community. Many of you have probably seen commercial plates and vehicles parked all around your neighborhood. Why is this a problem? Well, diesel, which is the fuel that these trucks use, it is pure nitric oxide, and that is a toxin to our health. We already have enough pollution from vehicles in the city during the day. And legally, these trucks, as per DOT, they should be in a garage. They shouldn't be parked in our community. We passed the reso because there are some agencies that are not enforcing this, thus not deterring the practice that people are doing. They might get one ticket or two in a month. That is a cost of business for these folks. We want to make sure that in our community, we get the enforcement that everyone else get. I would invite you to go through Lexington and Park Avenue, in what they call Lenox Hill, in that area, and take a picture and see how many trucks you see parked there overnight. Very few. The same treatment should happen to this community. Our lungs are no different than the lungs from the folks in those areas. So we spoke to our chair, and we're going to follow up with our electeds, because this is an important matter. All of us are breathing this pollution. And we passed the reso, we sent it to the electeds, and now we're going to follow up with them to make sure that everyone here can breathe at least a little bit of fresher air.
Edwin, if I may, can you hear me?
Yes, sir.
Yes, Victor.
Yes, Chair.
I'm jumping between you and Art, so I'm sorry I stepped away, but I caught that. What I'd like you to do, if possible, is to invite our city council member, Mr. Sean Abreu, to your next meeting to discuss the issue you're talking about with the trucks being stored and parked in our community. Also, I'd like to hear his opinion on 1727 on the record to see where he stands as far as supporting us and what we can do about that. So if you can send him an invitation to the health committee next month, I think that would be a great idea. All right.
Absolutely. Thank you.
And Edward, thank you for your diligence on the trucks that are out there. I've seen it myself. We have to keep pushing, and this is the only way to do it. We represent, as someone asked me the other day, I said, we're the voice, the ears, and the conscience of the community. And we act upon that. And this is something we need to act upon. So thank you. Appreciate it.
Thank you. And the other thing is that we will be working with other committees is residential parking. This is something that other cities, they have done. We have a toll that's going to come to Midtown. What is that? What is the impact going to be to us, right? We have many folks that travel from different parts of states. They come from New Jersey, they come from Connecticut. Well, they're going to want to avoid a $22 toll every day. Are they going to park in our community? New York City is the exception when it comes to residential parking. This is another tool that we can use so we can reduce the amount of vehicle. When you guys are outside, look at the plates of the vehicle that you see. And you will see how many of them are not from New York City. And this is another way that New York City can help reduce the amount of vehicles, as they say they want to do all the time, right? It's very simple. If you are in Boston and you park your vehicle outside, you will get a ticket. I got one, it was $155. I try to say, hey, I didn't know. Well, now you know. What do I do with the ticket? Well, you pay it. So the technology is there. They use these readers in the cars that the cops doesn't even have to get out. They can read the plate and see if you belong in that community, and they'll just send you the ticket home. So we need to have our electeds push that forward. Mark Levine had a bill that addressed that. Now I heard that this Rosa, Carmen de la Rosa, is the one pushing that forward. But I think that, we should push it forward from a health standpoint, because the less vehicle we have in this community, the more we push those folks from the outside to take public transportation, the better our health will be.
Mm-hmm. And you said Carmen de la Rosa has that now. She's the person sponsoring that.
Yes.
In the council.
Yeah.
Laquita.
Hey, Monica.
How you doing?
Okay, how are you?
I think if we're going to look at the we're going to lose more spots when these garbage containers come. But people are gonna start renting out their addresses for people to go and get permits. So I agree, but you know, like in DC, if you want to park your car on the street, you have to go to a police precinct and get a permit. Which is fine, but if we're going to, if we're going to move to permits, the people that get the permits have to show that that car is registered and licensed in New York City.
Yeah.
And that will eliminate some of it because people will be renting out their apartments so that folks can have a New York City address. Most people aren't going to do that because they won't pay the insurance.
Yeah, that's true. So that is something
So-
that hopefully for this season, we can put a resolution forward, because from a health standpoint, by us eliminating the amount of vehicle, think about it. We heard in our last meeting that people were looking for parking for an hour and 2 hours, residents of this community. Well, when folks are sitting in their car, sleeping in their car, and that car is on, that's idling. That, pollution is staying really close to us. And just because we cannot see it with our eye doesn't mean that it's not impacting us.
Right.
But I think another issue is, Edwin, there's really no parking lots around this neighborhood. And a lot of the parking lots are not 24 hours. I've said it before. A lot of people in this community work far away. I have neighbors that work in Delaware, way out in Pennsylvania, way up in Connecticut by the Massachusetts border. They cannot take public transportation. That just is, I mean, for somebody living in Midtown, that's a pipe dream. These people have to have their cars.
Yeah.
I have another neighbor that works way out in Staten Island. And to be honest with you, and I'm gonna say this, people don't realize a lot of the buses and the trains, the bus on St. Nicholas Avenue, it does not run between 3 a.m. and 5 a.m.
Right. I know that. Yeah.
Right.
But not too many people. Right.
Well,
right.
What we're asking for the city is not something new. If you go to Weehawken in New Jersey, you cannot park your vehicle after 7 p.m. You have the cops coming around and giving you a ticket. Parking is an issue nationwide. We in this community, we have an issue where we're getting bins for trash. Now we're going to have a toll coming to Midtown. And our residents, they live here, like you said, Monica. Those folks who have their vehicle registered here, they're paying higher taxes, higher insurance. Those who are coming from outside, well, when I went to Boston, I learned pretty quickly that if I wanted to park in the street, it was going to cost me $155, or I had to find a parking space. This is something that the whole world is dealing with. If you go to Madrid, it's the same thing. Madrid is even more strict than us. In Madrid, there's certain area that if you don't have a green vehicle, you cannot drive that car in there.
Right, but we have to be realistic that there's people in this community that use their cars differently. And I mean, Black and Latino people use their cars differently from the people that live in Midtown and the people that live downtown. It's something that we just use them differently. And I don't know if anybody at DOT has voiced that. Like I said, a lot of people in this community work far away. Taking public transportation is not an option. They use it.
I'm sorry to cut you off, Monica, but I think that's what Dr. Torres is saying. Like, if we have residential parking, especially for those individuals that have to commute to, and have to use their cars, they need to come back and realize that there will be parking space for them, so that when they go to work, they'll have a parking space available, because there's people, that And I was one of them that I was working. I live here on 146, and I was commuting to New Rochelle.
Oh,
Coming back will take me 45 minutes, then looking for
right.
parking, waiting for parking, having the car in idle. You know, if we have there's a lot of examples worldwide, you know, that here in the States, outside the States, where it could be possible based on your driver license, but based on your insurance,
Right.
car insurance, you know, there is a possible way for us to have residential parking where everyone could benefit and our health would improve.
It's true,
Mhm.
but you know, we have to be realistic about
Because
it.
Monica, the reason why they put the Midtown now toll, one of the reasons was to decrease congestion. That was, you know, the main point of how they got that approved.
Right. And the studies have shown that it's not going to do one lick of good. That's the problem. I mean, they did the
Well,
same thing in
we'll
London,
see, because
and people are still driving.
well, we'll see, because when you have to pay $22 every day, that changes behavior. If you have to use, you know, that path. But this is an ongoing conversation that we can have. Definitely a solution that has a health aspect to it, and that we should bring forward. Those of us who reside here, that's our number one priority. Those who reside somewhere else, if you live in New Jersey, and I go to Weehawken right now, I cannot park in the street. New Jersey is so strict that during rush hour, they have big signs that says you cannot drive through here during rush hour if you don't live here, and they'll
I
give you
know,
a
but
ticket.
that's it. Right. But
So,
there's still
so,
places to park. You have to
so,
find the ways around it, though. Everything is different.
so we have to address this. It cannot be the status quo that we have because it's not working for us.
It's not working for us. And unfortunately, you know, we have to not only compete with people coming from out of town, we got to compete with kids going to city college.
Yeah.
So, you know, it's all the way around.
Yeah. Okay.
It sounds like I don't know. It sounds like we need a subcommittee looking at this and being able to so that we could recommend to the committee, yeah, or yeah, make a recommendation to the committee. So let's just see where we can go with this and follow up with it, and then maybe by next week we can assign a subcommittee. Monica, is that something you'd like to you feel you can take on residential parking and, you know, from the health standpoint?
Yeah, but don't you actually have to be on the board to do that? I think you
Oh
do.
Lord. Well, our public members can
Well, we can offer opinion, but I thought you had to be. That
let
was
me look
my
into that.
understanding.
Let me see what kind of subgroup we can have, and then I'll get back to you on it. So maybe at the October meeting we can get back to it.
Okay, no problem.
Yeah, we have to address it before that toll kicks in, and it becomes a bigger problem for us.
Right.
You know, if you
so
reside
we can
here,
see.
If you reside here, you have the right to the spaces around here. If you don't reside here, whether you go to Columbia, NYU, City College, well, that's what happens. When I go to school in Roosevelt Island and I want to park outside, I have to pay $24 so I can park in the streets. Otherwise, I will get a ticket. So if I want that, then I have to take either a taxi or the public transportation.
And if I could just add, you know,
Yeah,
especially given the purview of this committee, if it's true, I'm not that knowledgeable about this, but if it's true that the congestion pricing policy will maybe lead to an increase of traffic up here in our community, I foresee a real health impact being not just the air pollution, but also pedestrian accidents. You know, I'm terrified walking around in New York City of a car that's going to come and hit me. So, you know, I think that could be a real safety and health related, public
Yeah.
health related concern that we might want to think more about if our community is projected to experience more traffic because of the congestion pricing.
Right. And we've made that argument, and groups have made that argument, including the NAACP, We Act. But it fell on deaf ears.
And we just have to keep trying. Let's
We
just
do.
keep
I
pushing
mean,
at it.
I think my hope is that there's still going to be enough litigation that it's going to take them a minute.
Uh-huh. Okay, let's see between now and, oh goodness, between
Sounds good.
now, we have to come back to it. It's nothing definitive here, except that it's a strong reason to act on it. Let's see who can kind of master that. And we really should see if uniform services and transportation can assist and play a role with this, like in a, as a joint
We can
effort.
invite them, if they want to join. But we have this is a health concern. We're looking at from the level of health concern.
Mhm.
Amir brought up another perspective, which is, the safety.
And there was some change in terms of streets and sidewalk demarcations and all of that a few years back, and it looked good, but this puts a wrinkle in that.
Yeah.
So they instituted those changes on Broadway in particular, left turn where turns can be made and all that from the safety angle. And they the Department of Transportation had a group, one of its departments, come to our community board several times, and we passed a design that they implemented. But now here we are a few years later with this other wrinkle, so we have to, be ready to act on it.
Yeah.
Okay, let's do that. But between now and October, so I'll kind of put calls out to the committee, emails, and let's just see where we can go with it.
Okay.
Thank you for that discussion. The last thing is the public health forum. Oh, by the way, everything else we've gone through, and thank everyone for staying on schedule. Maybe we can just spend about 10 minutes with it. Now there's a subgroup putting together the public health forum. We have from last year a bit of a small budget, and that we're using it in partnership with a few community partners: Columbia University's Irving Medical Center, Heritage Health and Housing. I was hoping to get Broadway Housing involved, but I got to talk to Hayel. And so I hope you can give me a call maybe on tomorrow. And then there's some other partners, perinatal. There are a number of other partners also. Columbia has some larger corporations as well. The format for the forum would be a major discussion on clinical research and trials in our community, and letting them know what impacts there are. They did a fantastic presentation of this back in June that we want to bring to our community. One dealing with cancer research, one dealing with tobacco and the harms of tobacco smoking. And there was a third one, my goodness, I think it was on maternal health. So we're looking for clinical trials and research being the centerpiece as a different angle in putting together a health forum for our community. On the side will be an offshoot resource room for maternal health, as I mentioned earlier, teens, and we don't want to call it mental health because that may not attract them. We want them to get health for the stresses that they are facing as young people. We want to provide that kind of open door for them to come in as well, which is why we've also reached out to groups, and we will reach out to the Osborne group as well, because they work with young people. I'm not sure if they're teenagers. I can't recall if it's teenagers, but to Wendy Mallett's group with Tall Omega Foundation as well. And generally put the word out at schools. We'll be reaching out to high schools, grade schools, parents to get those young people out. So there'll be offshoots or resource rooms where they can go. In addition, around the room and in that section will be tables and booths where our community partners and health organizations can talk about the services they can provide. So, and I just reached out to Harvest Farmers. Oh, all of a sudden I went blank on the total name, but Harvest Market, Harvest Health Market, so that perhaps there could be a section where people are actually cooking healthy, showing others different recipes where they may not think it would otherwise taste so good. If they get a chance to sample, maybe get some of our restaurants to come in as well. So on the healthy food side. So that's in the works. The big thing, we're looking at October, a couple of October dates. We had a meeting this past Friday. What we're trying to do is see if the forum at Columbia University is available. The transportation is good there. A second forum would take place, perhaps another part of the district, maybe at City College. But right now we put the dates out. October 21st will be our preferred date at Columbia's the forum. And we have, fortunately, Anita Chang, who's a former board member, but she produced for us the Link NYC ads that were featured on 84 of the billboards around our district, and they're mobile, and they can also be done as a verb where people are actually talking. So she's starting to work on that. Some will have a mental health focus, some will have information on the public health forum itself to get people there. But we have to just firm up the date, and firming up the date can also help us firm up who the researchers, the speakers will be. And the speakers that I witnessed on on June 22nd at, and Monica, you were there too, that I experienced in June. They were wonderful, and they were people of color. It was that diversity that was really good. They will also provide translation. They had about 3 translators working in the audience so that anyone who needed to be helped could have the headsets. So it's really going to be exciting. I emailed it to the committee just this evening, the planning document. Those are the key features of it right now. And some of the groups, the Youth Education Libraries Committee will work with us. The Seniors Committee will work with us. I mentioned a key partner is Columbia University Irving Medical Center. And we're the lead partner, Manhattan Community Board 9. We'll ask the Ryan Health Center to reach out with us. Heritage was at the meeting. They are already partnering with us and working on getting a mammogram van. So it's we're calling it a health forum, but there's the health fair component too, where there will be a lot of services, and we just need to get the people, I won't say packed in there, but really attending. And I think if we can work through our tenants associations and let them put the word out at their buildings, the schools I mentioned before, and other associations in the committee, we should be able to get a really good turnout of District 9. Doesn't mean that others cannot come, but a real good turnout of District 9 because there's too much critical, important information out there to help us to not be informed. Anything else related to that? If there's anyone who wants to participate, we need everyone on the health committee to be involved, particularly that day. But right now, on the health committee, let's see, Edwin and I, and representatives of all the agencies, but please let me know. Oh, Dr. Manguia, Clotilde Manguia is on that committee, and she attended. So that's at least 2 of us, but we really need, you know, there are a couple of others on the committee to lend their ideas. That's great. And certainly you can do it at, you know, by email to me, but we have a short window of time. Charlene, yes, the answer is yes, Charlene. Anything else related to the public health forum? As soon as we know, and I'm hoping tomorrow, Youth has already reached out to the forum to see what their schedule is. I'm hoping they get back to her tomorrow so that we know what date we have. And we, you know, everything else is kind of outlined, but we can go full forward once we have that date. And then for the committee, I mailed what's called the planning document to you this late afternoon. Please look at it. We met 3rd time this past Friday. Just look at it and see where you might want to assist. Reserve tentatively the dates and, you know, see where you can lend a hand. Okay. Any other questions? We're doing pretty good. It's 8:45. Anything else that has to be brought up? Oh, Monica, is that your? Oh no, no, she must be on mute. But the green light is around her. Okay, Edwin, you have anything else? It's always so great when you.
Oh, I think that we have enough, and there's always more. So I would like to tell, you know, the public members that if you know of anybody who is dealing with health, you know, issues in regards to the institution that we have in the community, we want to hear from them. If you are dealing with issues that is related to health into environment, bring it to our attention. We're not promising that we can solve them, but this is the way that we can raise that issue with our electeds who are responsible for this community, right? We're voting for them, so they have a responsibility. So any of you who are out there who see what's happening in the community, this is your platform. We just decided to be here, but you know, we'll take this as you want this to be taken.
And with that, again, welcome new members to the committee. We need your help, your support, and we welcome it. And welcome to our friends again since the summer who were with us all year and who have stayed with us. We generally do have a good turnout. Remember, October, again, we're going to try to meet. I know a couple of you have excused absence from being public, but we do meet in person in October. October 2nd is the next meeting. It's a hybrid, but let's hope everything can be okay where we can meet in person, okay? And with that, thank you very much again. And look at your emails over the next few days because you'll be getting something from me, LaQuitaHenry_1@yahoo.com. Okay, you can, and my phone number usually appears, so you can text me, email me, call me. I do pick up the phone. I know a lot of people like to just only text, but I pick up the phone too. Okay.
All right. Have a good night, everyone. Thank you.
Good night.
Good night.
Thank you.
Good night.
Good night, all.
Good night.
Stop the recording, pause. All right.